Everyone, it's really great to be here. So most of you are young here, which is beautiful to see. And in 40 years, maybe you won't remember, but the biggest problem will be a mental or neurological problem. And this is becoming very obvious because we are kind of killing cancer, dealing with heart problems. So the real thing is the brain. But unfortunately, as all the other organs are kind of simple to use or to understand, the brain is definitely far from that. So the challenge is much bigger. And also the type of problems that the brain can have are, of course, much, much bigger, because clearly this is the most amazing organ or creation. So this is what we are looking into doing. Maybe I should switch to this one. This is what we are going into trying to understand, interpret the brain, and be as much as possible able to read and provide remedy when needed, okay? So I'm a brain researcher. I've been in this field for over 20 years. The first half of my academic career was devoted to trying to understand how the brain actually performs signal processing in such an amazing way that it does. All right, so I was studying dolphins and bats and mole rats and elephants because each one of them actually has an amazing system of signal processing. And now in the second half, I'm actually trying to use advanced signal processing to understand the brain. And this is what we are trying to do. So really disrupt this field of brain monitoring in order to provide as much help in first neurological and later psychiatric disorders. So let's start with the real problem, and this is a summary of that problem. Unfortunately, this is statistics from the United States, but I believe that the statistics in Russia or Europe in general is quite similar, okay? So the shocking news is that the United States spends more on neurological disorders than on its military. In fact, $100 million more just on neurological disorders. And they're talking about close to 100 million people, which is kind of a little less than 1/3 of the population, that is suffering from some kind of brain disorder. And unfortunately, this number is going to rise because of the good news of the increase in life expectancy. And so if those people do survive for a longer age, there will be some problem of mild or more severe brain disorder or malfunction. And this is what we would love to try and understand and see what can be done. So let's let's try to dive into the problem more and see why is there a problem, okay? So these are the types of neuroscanners that exist nowadays. Everyone is familiar with the functional MRI, PET, CT, the big ones. This EEG, 256 electrode EEG, is still being used. And on the right, on your left, no, it's on your right, we have the BIS, the monitor, what's called sub-hairline monitor. And each one of them has problems. Of course, the big ones are not mobile, are not continuous, require expert to interpret the problems. And the small one, the BIS, the bispectral index, what's called, which is used mainly for anesthesia monitoring, has a lot of problems. Among them is the sensitivity to muscle activity. So basically, when we put an electrode on the forehead, we actually get more EMG, which is the muscle activity. That's a much stronger signal. We also get EOG, which is the eye movement signal. And only after that comes a very weak signal, which is the EEG. When we use a lot of electrodes on the head, we can use this method called ICA, independent components analysis, that can separate between the three types of signals quite easily. But when we have very few electrodes, this cannot be done. So this is why BIS and other methods that try to rely on very, very few electrodes on the forehead are more sensitive to EEG. And if you thought that this is old stuff and we actually don't produce such devices anymore, then you see that a very recent company is trying to come up again with a helmet that I don't think anyone would be happy to walk with in the street in order to do brain-computer interface. And of course, brain-computer interface is now becoming a big hit after Facebook talked about it and said that they are going to go into this field. So the question is, can we do something with much smaller much smaller number of sensors that would be on the forehead? Okay, and why hasn't it been done before? Okay, so this EEG signal is known for about 100 years. And the amazing thing, which is kind of, there's no parallel to that in any other area of science, is that the most seminal work, the most important work, was done in 1924. So this Hans Berger, sitting in his lab in 1924, using kind of prehistorical signal processing tools, was able to show that the brain produces several frequencies, because in those days they only talked about frequencies, that the brain produces several frequencies that are associated with its activity. So theta would have to do with combining modalities, delta would have to do with sleeping or minimal consciousness, and so forth. Okay? And that was so fascinating that the language that he developed in those days, those frequencies, alpha, beta, gamma, theta, are still being used nowadays. Okay, so this is a paper from 2017 and is exactly using the language that he created. Now, what's wrong with this? There's nothing wrong in terms of it's not wrong. However, it does not describe the whole story. So for you to kind of envision that, imagine that you were just hearing very simple tones, okay? Just tones of 1,000 hertz, 2,000 hertz, etc., okay? That would obviously not be a symphony, an orchestra, okay? And each one of us is listening to this orchestra. And what's interesting here is that there's a very, very wide spectrum of signals or frequencies, time frequency, that is being produced, which is actually producing the wonderful music that we hear. And I'm emphasizing this because this is a very good way to explain what it is that we try to do with the brain. So the story is that each one of you can sit very far from the orchestra and listen even with a single ear and hear the whole orchestra. What does that mean? That it means that in our brain, we decompose the signal, the single ear signal, into the different musical instruments. So we can hear the violin and we can hear the trumpet separately. They don't interfere with one another, although they are on the same frequency scale. The basic frequency is very similar. Okay? So we have a signal processing tool in our brain, not something that we are born with, something that we learn. We start listening to music, and those who start listening or even playing at a very young age have a better ability in doing that. And we learn to decompose those musical instruments, pretty much based on what we call color or timbre of the sound. And why is that relevant to the brain? Because when we look at different functional neural networks in our brain, which reside in different locations on the cortical sheet, have a different topology, have a different size, different types of synapses. These produce very fine color to their oscillations, much more fine than just the frequencies alpha, beta, gamma. And if we were able to read those fine features of these oscillations, we would be able to separate them just like we do with a single ear. We would be able to separate them just with a single EEG electrode. Now, you cannot use one. You can always use two, so it's a single bipolar EEG electrode, which is a difference between two EEG electrodes. Okay? And this is what we are trying to do. So the concept of putting a lot of electrodes all around the skull is kind of like the idea of putting a lot of microphones next to each one of the musical instruments, and because we don't need it, because we can hear the whole orchestra with one ear, obviously there's a way that this can be done, and the way this can be done is using harmonic analysis. So with your permission, let's talk about just a little bit the history of signal processing that is relevant here, okay? So everyone is familiar with Fourier. Few people are aware of the fact that Fourier exists already over 250 years. It became much more popular in 1967 when we had this computerized fast Fourier transform algorithm, which was able to do this kind of decomposition in what's called n log n times, when n is the number of samples. 10 years later, the mathematicians already realized that Fourier is not good enough, namely analyzing just frequency domain is not good enough, and wavelet was created. And after wavelet was created, about again 10 years later, Roland Kaufmann from Yale actually had an amazing contribution, which is called best basis. And what he understood is that from the same, what is called wavelet packet tree, this representation that can be built with wavelet, one can create not just one orthogonal decomposition, but in fact an exponential number of orthogonal decompositions, and moreover can find the optimal one at n log n time. Okay? So be able to actually find the optimal one very, very quickly out of many. And this is really the first time that signal processing is kind of meeting AI or machine learning or all this hype now about modifying the features based on data. So this is the signal processing parallel to machine learning, or if you like to say, it's machine learning but with harmonic analysis constraints. And a few years later, I realized that one can even modify the mother wavelet to fit into a very specific statistical data representation. And this is really what we try to do with our brain monitoring. So we use this harmonic analysis in order to find those very, very fine features that enable us to separate between the different functional neural networks. Later, if anyone is going to ask me where is it in the brain and how does that resemble to functional MRI, I'll go into a big story about why functional MRI, always talking about the geographical locations in the brain, is not relevant, and one really has to talk about functional brain networks and not about location. So once we have realized that, okay, let's take one example of what we want to try and do with this system. So post-trauma epilepsy, or first of all, let's talk about trauma. So every car accident or heart attack or stroke can lead to trauma, and those traumas can create a lot of problems. One of them will be epilepsy, and it turns out that the damage that can be caused in the hospital to a person arriving after the trauma, the damage that can be caused in the hospital may be much worse than the damage that was caused during the trauma, during the car accident. And why? Because there may be edema, namely increase in intracranial pressure due to fluids going into the brain, another stroke, or epilepsy, which is usually non-convulsive, namely the person does not move and does not show the epilepsy, and that can actually even cause death, if not great damage to the brain. And so it's extremely important to monitor those patients when they arrive to the intensive care unit. To give numbers, we are talking about 50,000 such people every day in intensive care units in the United States. Okay, so you can figure out why it is important. It's important to monitor in the very first few days when people are recovering from the trauma. And if there is a good monitor, a simple one to put, and most importantly an automatic one, namely one that does the interpretation, one that actually alerts the caregivers at the right time, then this of course can reduce the damage from this kind of post-trauma. All right? So this is what we are talking about, and some of you may have seen it in the morning. There's still a lot to be done, and definitely the adhesive is going to be better, and we have to deal with the case where people are sweating, which kind of causes trouble. But these are all technical issues, and we'll deal with them. Okay? So we want to create a very simple monitor, kind of like blood pressure monitor or glucose meter, and namely very simple numbers, very easy for a doctor to understand. A doctor does not have to be an EEG expert in order to be able to operate it. And all this interpretation will be actually done on the cloud with advanced machine learning, okay? So signal processing is creating the new representation, but then machine learning, classical machine learning, is creating the interpretation that makes it very easy for the doctor to understand. That's the device that we are looking at. And as you can see, it's very, very simple. As I mentioned, we want to take it into several of the main verticals in neurology. We are starting with coma and anesthesia. This anesthesia is induced coma. Why coma? Because it turns out that this is a huge problem, and I'll talk about it a little later. Okay? We want to deal with stroke and TBI, as these are the biggest neurological problems that people deal with. Let's talk, as the title of the talk is giving few perspectives, let's look at the perspective of the pharmaceutical companies producing a new drug, okay? It turns out that there's a very, very big problem there as well, okay? So a pharmaceutical company, in order to bring a new drug to market, the cost is getting now over $1 billion. And the question is why, and why has so few new drugs being introduced to the market? Mainly two reasons. One, the characterization of the patients that can actually benefit from the drug. And to say it in a simple way, we have been able to cure all sorts of memory problems, all sorts of attention issues, all sorts of Parkinson's issues, but unfortunately only in mice, okay? So on the mice model, we are doing very, very well, but it turns out that the very few % of difference between the genetic structure of the mouse and the humans is very, very important, and a lot of those medications don't work when we try them on humans. And so characterizing it on humans and actually monitoring those humans very, very carefully and understanding which ones these things work, which ones not. For example, ADHD and ADD, okay? Two causes of attention problem, but two totally different mechanisms which cause the problem. And of course, the medication will fit one, but not the other. And if you don't characterize those people and it turns out that this is still a problem, you cannot really see who is going to fit more. So if we can provide a companion to pharmaceutical companies doing their clinical studies, that can actually help them quite a bit. What happens nowadays is that a patient would be asked to take a medication, let's say against depression. He will take it for 2 weeks, and then possibly one of two things may happen. The first one is he's feeling better, And as he's feeling better, he said, well, I don't need this medication anymore, I'm feeling better. Because people don't understand that neurological problems are not like anything else that you just take antibiotics for 10 days and you recover. This is a management problem, okay? You have to manage it for many, for actually sometimes for life. And so they may stop taking the medication because of that, or they may stop taking the medication because it has severe side effects and they don't feel comfortable or they don't feel that the medication helps them so much with respect to the side effects. And the result is that the clinical study is not going to be successful because those people stop taking the medication or not taking them according to what they're asked. And the study will fail. And this is among the reasons why so few neurological drugs have been introduced. All right, if we can produce a dashboard. Okay, if we can introduce a dashboard, you know what? Let me tell you what's going on in the background. In the background, we are recording a couple of people with our device. And this is a great challenge because each one of you has a Bluetooth on their phone. So this seems to be working now. Maybe we'll switch quickly so that I can talk about that for a little bit. So I'll be presenting this kind of representation that we have created. And there's about 120 different functional neural networks in this representation. So this is the y-axis. As you can see, this is happening live. So this is moving 1 second at a time. So this is the x-axis. This specific region, so there are regions in this representation. This specific region is a very important region. We call it the executive region. We started doing those studies on people performing executive tasks, and we saw that this is when it is functional. When we started working with people with minimal conscious disorder of all sorts, or what's called vegetative case, namely those that really lost conscious almost completely, it turns out that most all of them do not have this functional region. We believe that this has to do with medial prefrontal cortex, so a frontal area involved in both in decisions and in emotions. Let me ask whoever we are recording, let me ask that person to go into deep breathing and concentrate on exhaling, only. So please don't listen to me, okay, but concentrate on that. And you will see that this activity is going to become blue. Their activity is going to be reduced. This is some kind of meditation that they are doing, and this can produce a very quick visual feedback of that meditation. Those who are doing meditation over 10,000 hours would be able to shut very, very quickly and shut completely their screen. So as you can see, this is working. May I ask you now, in addition to concentrating on your breathing, start doing this simple mathematical exercise. Take 1001 and subtract 7. So continue subtracting 7 many times. Try to push yourself, don't rest, and at the same time try to focus on your meditation. If this works, then we'll see that this area here, which is the cognitive area, it will start becoming more active. So basically, I mentioned the executive area. This area is what we call the emotional area. This area is the cognitive area, and the two areas at the top and the bottom are the extreme emotions or stress. So that's one way to read this representation. You can see that when they switch from just breathing to mathematics, this is not looking as it looked before, but it's looking not like this before and not like just concentrating on breathing. There's more activity that has to do with the mathematical exercise. Those of you who are doing it, now forget about the breathing, don't concentrate on breathing, and just do the mathematical exercise, but much more intense. So don't let yourself wait for a second. and we'll see what happens. We will definitely see increase here or not. We'll just see. I guess we are seeing one person, there are two people there doing it. Maybe we cannot switch from one to the other, but we definitely see. Okay, so math, I want to see serious mathematics here. This is one way for us to actually monitor patients and to monitor patients that are potentially are in minimal consciousness. It turns out that there's a huge problem now determining whether these patients are in minimal consciousness or not. And one way of doing it is giving them tasks like this and then seeing the brain response to figure out whether, one, they understand what it is being taught to them, and two, if they actually can perform that. People have tried to do that under functional MRI, but functional MRI, as you know, is a very difficult device. It's not pleasant to be there, and you cannot spend too much time being in the functional MRI. So it was very, very difficult to demonstrate in a functional MRI whether people are responsive or not responsive. With this device, we feel that this is much easier, and we are in clinical studies to demonstrate this. Okay, so we can see, if to summarize what we have here, this was before breathing, this was just breathing. As I said, this could be much more blue for someone that trains meditation more efficiently. And as we increase the number of tasks, we see more activity popping up, as we can see here. By the way, this is the classical spectrograms or frequency analysis of the same signal. So for those of you who are familiar, we see here just the low frequencies, and we don't see much information in the higher frequencies, but we actually do see a lot of information when we analyze the same signal with our method. So let me thank those who are doing it. Okay, I think this is done, and we can go back to the main screen. So going back to doing these studies and helping pharmaceutical companies to perform their studies, if we can provide such a dashboard, you can leave it if you like. Yeah, okay. You can see what happens when they stopped doing it. Immediately you see a change in the activity. So if we can provide a dashboard like this that tells the pharmaceutical company every day what is happening with all its patients, wherever they are, of course, one can maintain this clinical study much more tight, realize if there's problems in some area or in another area, maybe people were following a different guidelines for the study, etc. And one can really realize what is going on with the study. So that's one thing that one can help those pharmaceutical companies, and taking advantage of the fact that the sensor is very simple, can be taken home and can be used by anyone, is of course very, very important. So to recap what we just saw, this is a recording that we have that actually describes those regions. So as I mentioned, this is the cognitive region, this is the executive region, and you see them beautifully on the person that is practicing right now. This is the emotional region, and this is the more stress region. Here you see some stress, here you see more stress, but that's of course understood under the circumstances. To go back to this case, actually I did describe it a lot, but to really talk about how big the problem is and to persuade you that this is a huge one. This guy, at the age of 12, got into a coma. About a year later, he woke up of the coma, but it took another 11 years for his people around him to realize that. So for about 11 years, the person was locked in. He actually heard everything that happened around him. He heard that his mother said that she wished he was dead, etc. And only after another 11 years, he actually woke up to the point that he's now going and giving TED Talks about his condition and wrote a book about it. all right? It turns out there's work that's being done at in New York, Wearable School of Medicine, suggesting that a lot of the people that were thought to be what's called in vegetative state, namely non-responsive, are actually responsive and are actually in some form of minimal to less minimal consciousness, namely they are definitely aware of what is going on, but are unable to communicate. And what we are trying to be with this channel is to become a channel for them. Okay. Does that mean 2 minutes or Lenny? Okay, thanks. So we are trying to be a channel for these guys in order to enable them for describing their situation. And this is an example, if we can have this movie play. This is an example. Can you help me with the movie, please? This is an ALS patient that is getting to be in the locked-in condition, and we are working with him to produce a brain-computer interface so that he can talk. This is the person. He started this NGO in Israel, Prize for Life. He's very active. He's totally paralyzed, and he's sitting with the band on his forehead and moving this Bluetooth ball here just by thought. Those people have their motor cortex completely non-responsive. So what we do here is based completely just on pre-planning of the movement, but not on the motor activity at all. And this is something that we want to take to help those people as much as possible. So let me skip the anesthesia, which is a big story, and just mention that we are doing those things in lifestyle aspects as well, because enhancing brains for those who are kind of healthy but need some help with attention, some help with emotional regulation, or with depression, or with anxiety, then a device like this, just like the meditation that we saw, can be of great help. This is, by the way, an expert meditator. Can we go one more? Yeah. This is an expert meditator, and now we can compare it to what we saw. You see that they can actually become totally blue, keep this, close this executive area, and then do another meditation or meditation at the same time. So we see here 3 types of meditations. I think I'll stop here. I'll go to quickly summarize. I'll skip the competition and just say that the hope is to provide a tool that can be actually a neurological bedside monitor in the neurology department, in the operation room, and at home or the rehabilitation location for those people who need it, for those people who do not need it but want to prevent dementia or deal with other neurological problems or psychiatric ones. This can be an amazing tool, a neural feedback tool at home. The neural feedback can be passive or active, maybe with music, and there's a beautiful company in Boston, Project Sync, that is working already on providing active neural feedback via music. So the neural feedback can be of many types, but can actually help the brain dramatically. Thank you very much.
Thank you, Nathan, for a wonderful presentation. We have time only for one question from online. Somebody asked, how many doctors and how much data did you use in order to create the device and to launch machine learning here?
Mm-hmm. So that's actually a nice question. We created the data only with healthy people. At the beginning, we thought we will be using it on healthy people and for all sorts of lifestyle and enhancement. So we started with healthy people. Well, you know, as much as healthy students can be healthy, but basically students. And did other projects with various people that are performing intense activity. The amazing thing is that we also collected data from dogs, and it turns out that the brain activity of dogs is quite similar to what we saw with humans. So actually, detecting happiness in a dog and detecting happiness in a human turned out to be the same feature. So now we are doing various clinical studies on sick people, but we are using really tools that were developed just with healthy ones.
So thank you for answer.
Sure, thank you.
Yeah.
There was one question there. Do you want to take it?
Yeah.
Thank you. Okay.
And thank you for your question, actually.
Thank you so much.
Спасибо вам большое всем.